Xin chào, buổi sáng đến đôi bác sĩ Gish, bác sĩ gan, Sanford, Mỹ. And I would like to talk about liver cancer surveillance. Patients with chronic liver disease, especially hepatitis B, need to have testing and imaging done every 6 months. That's blood tests and an ultrasound. New addition to this is the ability to do elastography, transient elastography. This allows us to stage the liver disease and look at progression or regression of the liver disease over time. So every 6 months, ultrasound imaging, every 6 months, blood tests, and every 6 months, restage fibrosis with this advanced new testing. So when we talk about staging liver disease and decide on screening, remember screening's the first test, and surveillance is regular testing every 6 months. So I'm going to use the word surveillance, but we stage patients with at least 3 methods. Liver biopsy is almost gone. We're going to talk about blood tests. That's a blood draw that allows us to stage liver disease. We can look at platelet count and liver enzymes using something called FIB4 or APRI, and we use elastography. So every patient gets 3 tests to help decide if they have minimal, moderate, or severe liver damage, which would be cirrhosis. Cirrhosis is extensive scarring of that liver. One of the main tools we use is ARFI, A-R-F-I, Acoustic Radiation Force Impulse. This is an ultrasound-like device that sends sound waves in the liver and tells how flexible or how stiff the liver is. This is state-of-the-art and is comparable to first generation called VCTE, and we also have another generation called 2D shear wave. But ARFI is state-of-the-art, high quality, and gives us very, very good liver staging. Siemens is one of those manufacturers of ARFI, and they have high-quality instruments that give us very accurate results. So I work in the United States, I work at Stanford. At Stanford, we have a Siemens instrument. We also use other instruments at various sites, and actually have clinics in 7 different locations in California and Nevada. But at Stanford, our tool to screen, which is the first test, is to do elastography along with imaging and blood tests. Then we do surveillance, and it's depending on whether a patient has fatty liver, hepatitis B, or hepatitis C. It also depends on the stage of their liver disease, how often we bring them back for repeat testing, repeat education, and of course linkage to care. Hepatitis B is treatable, hepatitis C is curable, and of course fatty liver is treatable. We need people to eat less and lose weight. Thank you.